Hello, everybody. Welcome to the show. I got another great return guest. This is Dr. Joel Fuhrman. Dr. Fuhrman, how you doing, man?
Doing phenomenal.
Very
I,
well, very well.
and
I
another
love.
one of my daughters just got married.
Oh, congratulations,
And
congratulations. Are you a granddaddy?
oh, I have one in the cooking in the oven.
Nice,
The
nice.
first grandchild's in the oven.
Wow, wow. Well, I'm glad we got you here while you still have time because all your time's going to be for your grandchildren in the future. So that's the way it should be. That's great. But congratulations with that. What I want to talk to you about is we've spoken about all these cancer and heart disease and all these things that are ailing people. I'm going to put those links below everybody. But what ailed me was when I was 19 years old, I got diagnosed with inflammatory bowel disease, also known as ulcerative colitis and Crohn's disease. Now, after getting better and eating healthy, many years later, a lot of people ask me what they should do and what I suggest. And a lot of people often get uh, digestive health confused. If they feel anything wrong, they think IBS or IBD, and I don't know if they know the difference between these things. So, can we talk about digestive health in this episode?
Yeah, that's great. We can start on that.
Okay, so in starting off with, I suffered from inflammatory bowel disease and IBD, ulcerative colitis and Crohn's disease. And when that happened to me 30 years ago, it really wasn't well known at all. And today it's become much more common. Uh, and it's a terrible thing that people that don't know. But what do you do or recommend? Do you have talk about in a book, or what would you recommend to somebody if they've been diagnosed? Because it's often misdiagnosed, but diagnosed with inflammatory bowel disease. What do you tell them to do or not do?
Well, maybe we should let me just check on this. Okay, maybe we should just define what we're talking about first.
Okay.
Because inflammatory bowel disease, which is there's two types, ulcerative colitis and Crohn's disease, is inflammation of the gut, usually to the point of pain and bleeding. And it's an autoimmune disease. It's an autoimmune disease like lupus or psoriasis or rheumatoid arthritis or scleroderma, where your immune system attacks the lining of the bowel and destroys it. And so we're talking about a disease that's not only of the bowel. The immune system is the whole body. It comes from the bone marrow. It comes from your cells. Your cells see some part of the body as foreign and attacks it and inflames it. So the inflammation, even though manifests itself in lupus, let's say with skin disease or with kidney failure, and in inflammatory bowel disease, the attack is manifests itself with bleeding and inflammation and diarrhea and indigestion because the bowel's being attacked. So it's a type of autoimmune disease. That's inflammatory bowel disease, IBD, inflammatory bowel disease, IBD. Then there's irritable bowel syndrome, IBS. And that's not an autoimmune disease. That's when you just have when you're not digesting food well and you have bloating and gas and stomach pain and indigestion and alternating constipation and diarrhea. It's not as severe as inflammatory bowel disease because it's not associated with bleeding and destruction to the lining of the gut. Because Crohn's disease is usually higher up, whereas ulcerative colitis is mostly the colon, and Crohn's disease is when it can cover your small intestines and be severe enough to cause scarring and strictures and obstructions where people actually need surgery to heal parts of the bowel that have been so permanently damaged. What you had is more serious, the inflammatory bowel disease, and since it's a form of autoimmune disease, not a bowel disorder, we can't just treat it from the bowel itself. We have to, because it represents a person's overall health that they develop an autoimmune disease. So my protocols for reversing autoimmune disease are similar from lupus to psoriasis to rheumatoid arthritis to inflammatory bowel disease. They're relatively similar in building and strengthening the immune system and trying to normalize the immune system. And in general, disease has an common cause. All diseases have a common cause, and that is lack of nutrient density in the cells of the body and enhanced exposure and concentration of toxins in the body. Could be chemical toxins that are exogenous from the outside world, smoke, chemicals, pollutants, plastics, but it's often toxins the own body produces, like metabolic wastes, like aldehydes and formaldehyde, and reactive oxygen species, too many free radicals, and advanced glycation end products. But it's usually urea and there's a lot of things, a lot of toxins. So in our cells, in our body, we have a mixture of the endogenous toxins produced by the body itself and the exogenous toxins coming from the outside world that the body can't clean itself and repair itself with so much waste products. And the body's cells become abnormal. And then the immune system recognizes the surface of the cell as being abnormal, even though it doesn't have cancer, it's not dead, and the immune system responds overly reactive, responds to it and attacks its own body. So yes, so all those things come together, including the tendency of the body to become more inflamed when you have omega-3 deficiencies as well, contribute to the pro-inflammatory state of the body and the immune system. The problem with what makes inflammatory bowel disease so difficult to treat is that we're trying to nourish the body with nutrients. We're trying to fix the immune system by getting these high nutrient foods into the body, but the body can't digest things, and we feed them foods, it's going to cause diarrhea and bleeding and indigestion. So sometimes we have to be very delicate and very careful with what foods we're feeding the body while we're gradually building the body's strength in their immune system strength built on phytochemicals and nutrients, and of course detoxifying the body. And the methodology I use to help people with diseases involves some type of fasting, whether it's water fasting or juice fasting or giving special diets with only cooked foods like zucchini, like a zucchini diet or something. So sometimes we have to rest the bowel so we can get nutrients into the body again. So whatever, I don't know much about your particular case and what made you better, but I know about the hundreds of people that I've treated with this condition and the difficulties they've had. And each person is different, because you may have done better on a mango diet, whatever you did, it doesn't mean that would work for somebody else. In most of these cases where they have severe inflammatory bowel disease, and some of them have 15 bloody bowel movements a day. Like, for example, one guy was a patient of mine. He worked as a person in construction as a builder, and he traveled around in a van, and he had a portable toilet in his van because he had to go all the time. And it got so bad that he had to be hospitalized because his bowels were bleeding so bad, and they put him in the hospital on IV steroids and no food. Just liquids and IV fluid and steroids to stop the bleeding. And he was visited by all the surgeons and doctors in the hospital who told him he needed to have his colon removed and put a bag there, remove his colon because it was too severe to be fixed at this point. He had tried all the drugs. They slowed the bleeding down with the steroids, but they didn't see that he would be able to be sustained long-term on the steroids. So I actually took him home from the hospital, right from the hospital into my house. And I had him live in my house for a month, right out of the hospital, so I could continue to slowly refeed him and heal his gut. So in this case, I'm describing a case that needed delicate care and take him from a fasting state on steroids to be able to get the steroids out of his system, continuing his fasting state until I could get him more stable. And also rest the bowel so it was not bleeding. And then we fed him, a mush made out of mostly cooked zucchini. And then after a week of eating, adding some other cooked mushy vegetables to that, then we started adding things like a little mashed potato in that. You know what I mean? So we gradually built him back to be able to take, and then to be able to take some raw juices. That we could add, raw vegetable juices. The caveat here is I did not feed him salad and raw fruit at the beginning. I could not give him. It wouldn't have been, through our experience of taking care of people like this, with that if they're bleeding, we can't feed them raw food at the beginning, and they're better off with things that are cooked and easier to digest and pureed and get to build up the nutrients more slowly. But a person who's controlled with their inflammatory bowel disease, who's not bleeding and who's not active, we can start to give them raw foods and chewing them real well and giving them soups and right at the beginning to get their body built back again, you know.
Yeah, well, it's a lot of things you said there, and it's like it's a terrible disease, but the body reacts so quickly to it that you know when it's healing, how it's working based on, like you said, is the bleeding stopping? How many cramps are they getting throughout the day, and how many bowel movements are they getting? So you start to see the improvement like right away, unlike some other things, you gotta give it some time. This way you get to know, and I'm full agreement with you. You wouldn't want to give somebody an inflammatory attack the roughage that comes in salad greens. It's not a good idea. So a couple of questions come to mind. So people are so sensitive at that point when they're in the middle of an inflammatory attack. Would you ever suggest somebody, because the steroids usually work in of course there's side effects, but it usually stops the bleeding and slows down the inflammation. And in certain cases, when people don't have the patience to to do it with the way you would recommend it, would you ever recommend them, look, take the steroids, get out of this attack, and then we'll help you get rid of the steroid poisons and so on? Or do you go by people's like patience and things like that? Would that ever seem like a possibility or something?
Yeah, yes, you're making another good point because each case is individual. Like we can't give talking about this type of disease is a serious problem. We can't give one way of treating everybody. The cases that are just starting out, we don't have to put them on drugs. We could start them out with some episodic fasting and some get them to rest their bowel and use nutritional protocols and get them well with no medications even. But some cases that are so advanced and in condition, and they're not in good, their condition is so fragile that we can't, that we need to use some medications to stabilize them first. And sometimes IV fluids. I've had people who had inflammatory bowel disease who we started to give them bowel rest, and they started to develop vomiting and dehydration. They needed to put an IV in to give them electrolytes. You know what I mean? So each case is different, of course. And some people, but the bottom line is that when people start getting digestive problem, instead of waiting till it gets so bad where you'd have to go on steroids or be hospitalized, you Remicade or some kind of immunosuppressant like that that's so severe that can cause cancer. We want to get them started on this right program early enough in their bowel complaints that they don't get to the point where their disease gets that severe, because autoimmune diseases are reversible and people can recover from them. And as you know, I've had a woman on the National Renal Transplant list waiting for a new kidney with lupus who made a complete recovery off all medication, kidney back to normal, never needed a transplant. And this man I'm talking about never needed his colon taken out. He regained the use of his colon and be able to back to a functional life again. And I've had so many people but some people with Crohn's disease, which is the form that attacks higher up, some of them have done very well and control their Crohn's long term, and they're still fasting right now. In other words, some of them fast 2 or 3 days every 6 weeks. And with the right diet, it seems to keep the inflammation gone by them giving themselves some bowel rest, 2 days a month, 3 days every 6 months. They still episodically do some fasting along the way as they're following the right program. Some don't need to do that. So we divide. So in other words, the protocol is very individual. This is a disease where you need individual attention to devise a protocol that works for you. So we work with the people, figuring out what works best for them. And you can see they're feeling better, they're digesting better, it keeps them in good tone. They wind up. And there are also some people who've had a history of Crohn's where they've had so much scarring and surgeries where they have strictures or they have some problems where they are not going to be able to have total normal digestive experience. Because they still have chronic problems in their bowel from damage to their gut that can't be fixed nutritionally. They would need surgery to take the scars out.
Well, so some things come to mind. So first, somebody with an autoimmune disease, me, it just happened to be my colon, somebody else, lupus, or somebody else. Is this just inherited weaknesses that your body's attacking that weak area? Like why, for my autoimmune disease was in my colon and somebody else's might be a different area of their body. Like when autoimmune attacks, why different areas for different people?
That's an excellent question, and I wish I for sure had the answer to that. But I think you're right. There's a genetic tendency to develop autoimmune disease. So autoimmune diseases do run in families, but the genes don't determine your future because genes are modified by your diet and how you live in your life. So we say the genes like set the stage or give you the blueprint, but then that blueprint is modified by what you eat. You can excite the autoimmune disease or you could silence those genes to not cause a problem with excellent nutrition. So gene silencing and gene modification through good nutrition is much more powerful than what you inherit. The inherit gives you a tendency towards the disease, but is not a primary cause of the disease itself. But yes, some people would be more prone to a type of autoimmune disease than another type. But most cases of autoimmune disease in the United States today, there's no family history of having those autoimmune diseases because the explosion of autoimmune diseases has paralleled the rise in cancer from 1950 to the year to 2000. We've had an explosion of cancer, of all autoimmune diseases and cancers going up as we've had more exposure to toxic food, fast food, and processed food in the country. You know,
If my children,
by the way, a primary cause of inflammatory bowel disease is fried foods and exposure to heated oils. It's a primary contributory cause of bowel disease. And
eh,
we have people are living on foods that are fried or heated with,
yeah,
or oils that are heated, you know.
yeah. If my children eat a healthy diet, are they at a higher risk to get inflammatory bowel disease because I suffered from it, or is it more diet
No,
related?
no, it's not. If they live and are raised on a healthy diet and don't expose themselves to fast food and petrochemicals and plastics, but particularly fried foods, you know, but then again, if you live in southern parts of the United States and you expose yourself to lots of fried foods, even people without those genetics develop all kinds of crazy
Sure. So
problems. It's the
would you say inflammatory bowel disease is 100% diet related or or not necessarily?
it depends on the context of that sentence. I could say that if I could raise a society with great nutrition, you would not see inflammatory bowel disease. And we could say it's 100% diet and environmental related. But since I can't raise the society since birth with good health, then I have to say it's partially genetic and partially dietary related because our diets are not good enough to completely suppress the genetic alterations and genetic defects that can contribute to it. But keep in mind that our genome or our genetic is not just from what we eat, but it's also from the way our mother and father ate in our ate, and from prior generations, particularly your mother. In other words, the diet your mother eats, not just during pregnancy, but even the foods that she's exposed to or before she gets pregnant, because the eggs that form you lived in your mother's body for her whole life until she got pregnant. Your eggs were formed in the womb when she was in her mother's body. So your eggs, when a woman gets pregnant at age 33, the eggs have been there for 30, almost 34 years. You know what I mean? And those eggs are damaged by her diet. So here's an example of that: is that the leading cause of death in children is acute blastocytic leukemia, other than accidents, and that's linked to the mother's diet even years prior to conception. And it's particularly linked to luncheon meats, like the consumption of pastrami, bologna, bacon, and hot dogs. And that also, the bacon, pastrami, hot dogs, and fast food hamburgers are also linked to brain tumors in children. So when you have a 12-year-old daughter that gets a brain tumor and dies, that was contributed to by the unhealthy foods the mother ate, not just during pregnancy, but even before pregnancy.
How much before pregnancy? Like when they were little kids or their whole life or just
They usually talk about 2 to 3 years prior to conception is
okay.
still a frat. And we're advising women today to not to have seafood, particularly bivalves and crustaceans and crabs and lobster, even 5 years up to being pregnant, because we're finding that the nanoplastic particles and the toxic metals and the other petrochemicals that you get from being exposed to seafood take 5 years to leave the body, you know? So it takes 5 years to clean the body out. So so we know that some of these toxic chemicals, like seafood, is a Geiger counter. The Geiger counter means that if you eat it during your pregnancy, if you drink alcohol, take drugs, or eat seafood during the pregnancy, you expose you to enough toxins that it could damage your child, right? But when you're not pregnant and you're 35, 40 years old and not having any more children, it doesn't mean it's not damaging you. It's just there's no Geiger counter to reflect the damage so quickly. So it takes now decades for you to see the damage, and you don't relate it to your eating of clams and oysters and lobster and processed meats and fast foods. And you don't see the damage because then you get a cancer 30 years later and you didn't know you caused it when you were. And then the other major cause of eating these toxic bottom feeders, because I'm mentioning fish and small fish like sardines and minnows and things are now full of nanoparticles and plastic particles. And when you eat the digestive tract of small fish, you get exposed to plastic, and plastic infiltrates the brain. But we know that the filtering of so much water through clams and oysters and scallops and the bottom feeders get a lot of settling of algae. And the algae produce especially the different types of bacteria, cyanobacteria, that produce a compound called BMAA. And this is a compound that's been found in lake fish with runoff, agricultural runoff, producing more algae growth in the waters. But also it's all on the continental shelf now from so much dumping of garbage in the ocean. So we have the BMAA shows clustering of ALS, right, which is Lou Gehrig's disease, which is quite a severe disease, and then life-threatening, terrible, horrible problem. And then, of course, PDS, Parkinson's dementia syndrome now, which develops later in life from people eating a lot of seafood earlier in life. You know what I mean?
Yeah.
And there's no way they don't relate the later life dementia or Parkinson's with early life exposure to these foods. But now we're showing the studies do link them, are showing the long-term links. But particularly, young people have no idea of the long-term damage that cumulatively affects your body when you eat these foods throughout your whole life, and then you manifest with some disease, or your child develops with some problem, and they think it's genetic. Well, yeah, it's kind of genetic. But so when you ask me that question, would it be totally genetic? Well, if I can control the diet of the parents for their lives and the children for their lives, yeah, it would be totally genetic. We got to control not only that person, but their parents' diet as well. You know what I mean?
What do you mean for their lives? Not just 5 years before the kids are born, or their whole lives?
Well, if we could say, people could disagree, and I could say it could wipe out 85% of cancers if people ate healthy. Yeah, but I could wipe out. It sounds like Name That Tune. I could name that tune in 3 notes, But yeah, I can name that tune. I could wipe out 98% of cancers if I could fix the diets of the generation before.
Sure.
Not what I'm saying. So
Sure.
yeah, the eggs of the children are affected by the diets of the parents, of course.
All right. So how about this one? So I'm better. For 30 years now, there's only one time I had an issue. Now, before I get into that issue, would you say that somebody who has an autoimmune disease, once they're better, they're cured, or would you say they're in remission? Because when I tell people I'm cured, they say, no, you're just in remission. The only time I had an issue was after, as long as I've been eating my diet, I had no issues. I got off my diet one time in 30 years, and I felt a little comfortable, and I did it, and not by much did I get off the diet, but I started to have issues again. And I said, well, I'm going to do what I did, worked all these years, and then it was fine. So, and I hear stories about people, they don't have an attack for 10 years and then they have an attack. So if somebody is not getting an inflammatory bowel attack, would you say they're cured or in remission? What's the medically right diagnosis of that? I know with cancer, they say if it's a certain amount of years, then they consider it a cure for their rickets, but it's a little different. But what would you say about the inflammatory bowel disease?
I don't know. I can't ever give people a straight answer. I'll give you another convoluted answer. Like, for example, a person has rheumatoid arthritis, right? And I put them on a diet and their pain goes away and they're feeling great, okay? They're not better yet, because if they go off the diet for a few meals, even if, 3 or 4 meals, the pain starts to come back. But if they get them eating healthy for a couple of years and they're in remission, now they can go off the diet for months and not have pain. And some of them go off the diet because they don't have pain when they eat badly. But what happens is because they still have this genetic tendency to develop that problem, if they go back to their former way of eating after 3 to 6 months, they may come with a disease come back. I had one guy, right? He was a butcher. He comes to me and all I did was change his diet. And he has severe rheumatoid arthritis, right? And he gets totally well. No fasting, just diet change. I don't see this guy again. He comes back to me like 2 years later, and his rheumatoid arthritis came back again. I said, "What happened? You were well for like a year. How did it come back?" He said, "Well, I was feeling so well, and I was even tried to eat some meat again, and it didn't cause me pain. So I went back to my old diet and started eating meat all the time. And now, after doing that for 9 months, my arthritis is back." It took him 9 months of going back to eating badly before his rheumatoid arthritis came back again. Can you imagine? So this time, I changed his diet back to the healthy diet again and got all the junk out of his diet, all the oils out, all the grease out, fed him vegetables, did everything I can. And his rheumatoid arthritis did not go away. Still there after all the diet change. So then I had to put him on a fast, where I put him on a water fast. And on the 7th day of the water fast, his shoulders flared up like crazy, causing tremendous pain. I said, "We got to keep fasting now. You got to complete the 14 days. So you got to keep fasting because now we mobilized some toxic waste. We got some stuff coming out." So he fasted the full, I think he fasted 15, 16 days till he felt totally well again. And then till his pain totally went away on just water. And then we slowly got him back onto eating again. And then his rheumatoid arthritis went away a second time. Much harder to get it to go away the second time than it was to get it to go away the first time. You follow me?
Yeah, absolutely. Interesting. And of course, the longer they're eating healthier, the longer it will take to come back again if they go.
Yes, yes, yes. So how do we now, to go back to answer your question? They don't lose their genetic defects that cause them to have a tendency to develop that disease should they go off the program and go eat unhealthy again. What if a person has diabetes or obesity or heart disease? We get rid of their diabetes in 3 weeks when they eat healthy, right? Are they in remission or are they totally cured? What about being overweight? Are you in remission? You're totally cured. Well, it's a semantical argument because they're totally cured if they stay eating healthy and keeps themselves thin and they exercise and eat right. But if they go back to eating junk food and fast food and put back 50 pounds, they're not, and maybe so I don't care what we call it. You know what I mean?
Sure. Now I have found
you're not supposed to be worried about that. You're supposed to stay living healthfully. And if you're not sick, you still should be living healthfully because we all have some weaknesses. We all have some genetic weaknesses we inherit. And if we don't eat healthfully, those weaknesses are going to flourish and be expressed and develop some problems. You don't escape from the laws of cause and effect.
Well, pain is a great motivator, and it's almost more difficult for somebody who never gets sick to change to eat healthy because they have this crazy thinking, when I get sick, I'll change, but until then, I'll do what I'm doing. And it's like, did you hear what you just said? When you get sick, I mean, if you change now, you won't have to deal with that later, but they don't make that connection. And it's like,
and some of these diseases are hard to get rid of in the person. And also the first symptom of a heart disease can be your death. 40% of people have heart attacks are dead on the spot, but they don't make it to the hospital alive. They're dead from their first heart attack. And they never knew they had heart disease because now they're dead from it. And they're right. So that's like craziest thing.
So with inflammatory bowel disease or all autoimmune diseases, I found a big connection between wheat products and also dairy products. So one of the first things I tell people, I said, whatever you got to do. I mean, I know your protocol and I tell them a lot of similar things, but you definitely stay away from wheat and dairy products because this will bring on an attack or cause an inflammatory thing. So
let me just say that fried foods are worse. Fried foods are the worst. You go to fast food restaurants, you eat fried chicken and French fries and fried devil dogs and donuts, and you can't expect to have, you're gonna damage your gut. And you damage your gut when you don't have an autoimmune disease when you eat those foods,
Yeah, absolutely, absolutely. So what do you do? Like I know it's individualized, but you also got to look at a person's, their demeanor and where their understanding is. But people contact me all the time with inflammatory bowel disease. And it seems now more than ever, believe it or not, Dr. Fuhrman, they're from India. A lot of people are contacting me from India more than ever before with inflammatory bowel disease.
Really?
I mean, what's the first thing you tell them? Like, if you're going to do anything, you got to do this, or there are particular, sometimes I find now that I didn't know back then, was there certain supplements that can I find somewhat help people uh, besides diet. But what do you tell people? Of course, you get their history, what they're doing, and all that, and then you tell them what they need to stop doing. But is there something that across the board? I guess fried foods is your answer. You tell everybody right across the board, you got to give up fried food, or I can't work with you, or something like that.
Oh,
What do you?
no way. That's for sure what you just said.
Yeah, yeah,
I'm not going to treat a person who's eating fried food,
yeah.
but of course they the greens have the substances to normalize immune function. And I tell people if you're not going to eat green vegetables, you might as well live close to a hospital because you're not going to recover without a high green diet. So we're using greens pureed into green smoothies. We're juicing greens. We're making them into soups. And when they first start, and most people can still tolerate green juices and green smoothies where they don't have to be all raw, and they don't have to avoid raw food unless they're really having, heavy bleeding. You know what I mean? So we basically have them on a vegetable, a mixture of raw and cooked vegetables with lots of greens. As the greens is the therapy for bowel disease. That's the main therapy, a high green vegetable diet. And the same thing with the irritable bowel syndrome, which we didn't talk about, which is just gas, which is bloating and gas, which is mostly because people overeat food and they eat and extend the capacity of their digestive tract to adequately digest food. So they're used to eating till fullness, they distend their bowel, they don't have enough enzymes to adequately digest what they're eating, and they chew so poorly that they don't produce enough endothelial growth factor and ptyalin in their saliva, and they not showing enough greens that produce enough nitric oxide in the mouth. So without the nitric oxide, without the bacteria produced in the mouth causing production of, and without the endothelial growth factors in the ptyalin, it irritates their bowel. Their bowel becomes very easily irritated, and they can't digest food well. So they've exceeded the capacity of their bowel to adequately digest for so long that the bowel has lost its capacity to digest properly. Like the beta cells in the pancreas lose the capacity to produce enough insulin after overusing them for so long, requiring the body so much insulin, they start to poop out. Well, your digestive tract starts to poop out in its digestive capacity. And then people get diagnosed with small bowel bacteria overgrowth. They go to doctors. Doctors give them antibiotics and give them all. So doctors just screw them up more because instead of getting them eating more reasonable sized meals that are easy to digest and have them focus on learning to liquefy food in their mouth before they allow it to be swallowed and chew how to get well, they just try to get them on the remedy mentality with trying to kill bacteria in the gut, which just cycles them back through. Now you got more yeast, and now you got all bad bacteria. Now you got it all over again. And you feel better for a few months. Now you're gonna feel sick again. So yes, it takes. In any case, here's the message that we're giving people is it takes diligence and persistence in careful and excellent lifestyle habit to earn back good health in a permanent way. The remedy mentality where you're looking for a pill or a magic substance to get you well is not that effective, even and especially with irritable bowel syndrome, people with chronic bloating and gas. They have to, so they have to be willing to make the dietary changes to eat very healthy foods. You see, most Americans, they get used to sucking down like scrambled eggs and meats, and they get used to sucking down, yogurt and cereal and stuff and white bread that doesn't require much chewing because the stuff is already have little fiber and is already cooked.
Yeah.
And so when you switch to a diet with a lot of roughage and fibers, it requires a lot of chewing and mixing and liquefying. And a lot of people's digestive tract, it doesn't have the buildup of the healthy bacteria, the thickened biofilm, the right level of enzyme production. They don't have the capacity to handle all the, so they go back to eating a diet. Oh, I went back. I feel better if I just eat eggs and yogurt and eat lamb chops now. I went off eating all those vegetables. I feel worse. And that's going to make them die of that's going to make them temporarily feel better, but it reinforces the bad diet and they can't ever digest a bean. So we do it a different way. We take time to chew real well and train their body to build the right bacteria in the gut and gradually have them earn back the capacity to digest roughage, salads, cooked beans. And, so by giving them, I might give a person a teaspoon of beans with every meal chewed real well to a liquid rather than take them away, because you're never going to learn how to digest them and to produce the enzymes and bacteria to degrade them if you're not chronically exposed to them. So something as opposed to removing it from the diet, of course, we're cutting it back to a small amount, but we're giving it with every meal 3 or 4 times a day, not taking it out of the diet. They make things worse. So people go to the doctors too. They'll go to these alternative doctors and get these like blood tests to show they're allergic to all these foods, and they're not allergic to them, and they're avoiding these foods, which don't really make them better. They just make them develop more allergies to other foods now, because it's more digestive intolerance. The IgG, it's not a real allergy like a RAS test or an IgE allergy where you would have your throat close up or your skin rash. It's just digestive intolerances, you know.
Sure. What about probiotics? Do you ever recommend probiotic supplements for people in these situations?
I do, but judiciously, because probiotics don't take the place of building your own diversity of the healthy bacteria. So you can't build back a healthy microbiome with probiotics or with even fermented foods. We have to do it by eating some raw green vegetables and some onion or scallion in there chewed real well, and some cooked mushrooms and cooked beans, including a little cooked soybean. We do a better job at building a microbiome if we do it with food. And then we could use some fermented foods. I prefer to use the ferments that don't contain salt, like, for example, a fermented wheat germ extract or a fermented soy drink that's made with nitrogen fermentation, and there's no sodium in the product at all. So I rather than using kimchi and sauerkraut and stuff where they use salt, it's bad to be on those. Salt can also cause inflammation in the gut too, and so yes, we can use some ferments, but mostly we're doing it with, in other words, we're using those things without eating the right food. It's not going to stick. It's not going to live. It's not going to hold on to the villi and form a nice biofilm. It's mostly your biofilm as the result of the healthy diversity of fibers in your diet. And we're training people to grow a wide diversity of bacteria, not just take the ones in the probiotic, to grow a wide diversity with a lot of different types of food fibers that now you can digest because we strengthened your digestive capacity.
Do you do any sauerkraut or kimchi yourself personally sometimes?
Absolutely not.
No, because of the salt?
Correct.
Now, there's a company that makes kimchi with no salt. A raw food company, I think. They do
Oh, that's
that.
cool. Yeah, I'm not
Yeah.
aware of that, but if that was, I would have no objection to that if that was the case.
Okay. Now, in your own personal diet, do you do no salt or you just keep it very minimal?
Almost no salt. I may occasionally have like some kind of like, I don't know, like a slice of Ezekiel bread that has 80 milligrams of sodium in it or something. I'll have some things that have a little, or some mustard that I squeezed on in my salad dressing. I mean, that has a little tiny bit in it, but I'm very low in salt.
So now it sounds like when you talk about diet, you're a big advocate of food combining, or somewhat to a degree, of combining foods correctly. Is that true, or is
No,
this?
I don't think so.
No, you don't think so?
No, not real, not, no, probably not. I'd rather people to eat foods very regularly. And because the old natural hygiene type food combining was like eat fruit alone, eat melons alone, don't combine starches with nuts, don't combine potatoes, rice, corn, and peas with nuts. And so I don't do any of that kind of food combining. I think it's good to mix a lot of different foods in your meals and in your diet as much as you can. That doesn't mean that doesn't mean some people can't handle some particular combinations individually, but usually I don't recommend that type of food
Even in
combining.
cases of like when inflammatory bowel disease or something where they already have compromised digestion, even in cases like that, would you recommend something more until a person's better, more mono foods, or would you still recommend having foods that are traditionally miscombined that just makes it a little harder to digest certain foods, or you don't, in no case do you care about the food combining stuff?
Well, I'm certainly, if a person has a problem with handling a certain food, or they just can't digest beans, or generally can't digest most nuts or stuff, I will certainly not, give them the meal without those things. And when I start to reintroduce those foods, we'll give them very small amounts to gradually get used to them. But what I'm saying is, it's not combining the food as much. If they can't digest beans, then I'm going to start giving them like a teaspoon of bean with each meal, not a quarter cup of bean with dinner or a quarter cup of bean by itself, but a teaspoon with their salad. And I'd rather them to eat it more frequently, not less frequently, a tiny amount more frequently to develop. So they develop the digestive capacity to handle it over time. And so they start to build back the healthy bacteria in the gut to handle it. So it's not take food combining means you're like taking it out and not mixing it. I'm mixing it in there with, but in very small amounts. You know what I mean?
Sure, sure. And what
And
about
we're not combining bananas with berries in the morning much, just because the bananas and apples and pears reduce the polyphenol and phytochemical benefits of the berries and pomegranate, so we don't combine those together. But
sure?
other than that,
And what
um,
about what nuts and seeds? Like, are you an advocate of soaking them first or not necessarily?
not necessarily. You can eat them both ways. They could change the nutritional profile, but they don't have to soak all the nuts and seeds.
You don't find them more digestible if you soak them first?
For some people that have those issues, yeah, but most people with good digestion don't have to worry about that. And you could eat them soaked or not soaked.
But regardless, the key is to chew them well, especially nuts and seeds, right?
And especially beans and especially salads and especially cruciferous vegetables like raw broccoli or raw collard greens or raw bok choy. You got it when you're only going to get the full benefit of the isothiocyanates of the anti-cancer effect and the nitric oxide production when you break open the cells. And most people's chewing only breaks up 10% of cells, and you could chew really well and break up to 90% of cells. So the point is yes, it's mostly chewing to a liquid. And it takes a lot of mindfulness when you're eating to concentrate on not swallowing until the food is completely liquefied in your mouth. And
Yeah.
but people with digestive disorders, eating less and chewing better is just miraculous results just from those two things, eating less and chewing better.
I always say to people, you can learn a lot from dogs. They say, what do you mean? I say, you never see a dog bark with food in its mouth. But people, you see them talking with food in their mouth all the time. It's
I don't know. You should learn to eat from my dog.
yeah, he'll eat anything, right?
Not only will she eat anything, she'll swallow it down so fast that how does she even without chewing? It should just
Yeah.
suck it right in. But anyway, whatever.
So so
We're getting on a
when
different subject.
when it comes to people, fried food you mentioned, it's such a interesting thing. Like we know like French fries and things that are fried, potato chips are definitely fried and bad. But then there's things like pancakes. And I look at people and there's like they're like, oh, I'm eating healthy pancakes, but literally you're eating a fried cake and,
Yes.
and, and it's considered healthy, but it's still like a terrible food. Like
If
some
you put oil in the pan, then you're frying a food. If you're heating an oil with a flame, then you're eating a fried food. And because heated oils are genotoxic or are
what
kind
about
of
frying without oils?
well, if I chop up some onion and throw it in a pan dry, I can cook it till it's glistening and use the fried onion in my meal because the moisture in the mushroom or the onion will make it so it's not going to damage it. But if I keep it in the pan too long till it browns or darkens, then I've formed, caramelization, crystallization, acrylamides, and making it's no longer healthy. So yeah, a lot of chefs want to bring out the flavor by caramelizing in their cooking to darkening or browning foods, but even if they cook them without oil, they're causing damage that isn't healthy to you. So yes, we most use water-based cooking methods. And when we dry cook, when we're like frying onions and mushrooms in a pan, you want to make them so they're cooked and glistening, but not browned or caramelized.
All right. Somebody with IBS or IBD, they're hearing this interview. They said, I like Dr. Joel Fuhrman. I want to follow his protocol. Is there one particular book or program that you recommend them get of yours?
I always recommend people read my latest book, Eat for Life, because it's just more recent, updated references. You want to read references
What
from
year
science.
was that put out?
That was put out in 2021.
Okay. All right. So
And
you
then,
recommend
but then
people
I
read
have a
that?
position paper that gives my protocols. I have a position paper on inflammatory bowel disease. They can get on my website at drfuhrman.com. And then I also help people by having them ask me questions on the website. They can join the membership on the website and ask me questions about their condition. So I usually like them to read a book, read the position paper. If they have cancer, watch my cancer masterclass. Learn something first. Then you come back and ask me questions about how to coordinate it to your particular needs. So it allows me to answer like hundreds of people's questions a day about their conditions. So it can help a lot of people.
Are those physicians articles part of their membership, or can anyone read them?
I think anyone can read them. Yeah, a lot of the stuff, I'm not sure of all. I'm not sure.
Okay. But all information about your membership program and all this information mentioning, I know people can type your name in the internet and find everything everywhere, but the main place is your website that people can find the most information that you're talking about, right?
Yeah, if they want specific information about their conditions, they should have to go to my website because most of my general speeches on YouTube are to the general audience, not specific for a condition. So I even have an A to Z on your particular disease states on the website, a rough overview of how I treat things. And then also I do podcasts with my daughter called the Eat to Live Podcasts, and you can scroll through all the different podcasts, and I might be talking about a subject you want to hear about, you know?
Yes, I like seeing those, and I just glance and dream about the future when my daughters are older that they would do something like that. I mean, that's wonderful that your daughter's working
Oh,
with
you've
you.
seen the podcast with Jenna when your
Absolutely. And
daughter.
I'm like, I keep that. I hope when my daughter's older, she'll want to do stuff like that. That's great that you keep it in the family. It's wonderful. That's great.
Thank you. Thank you.
What about, I know you don't have an office where people can walk into, but do you do consultations at all in any circumstances, or are you done with those?
Very occasionally, what it is that I have a retreat in San Diego, and people who have medical problems or are overweight or food addiction issues or some condition, they come and stay with me for a month or two or three. They stay here and they rent a room and they stay with us for a long period of time. So I'm definitely, consulting and working on those people's health. But they're here because it directs my energy and attention to people that have this time frame where they're living under a really healthy environment. I know they're not going to be, they know they're going to be very compliant, and it takes that continual compliance to be able to get comfortable eating this way and stay with it long term. So that's the way I've kind of like transitioned from a full-time practice to a part-time practice as I'm older now. You know what I mean?
Is that retreat information on your website, or is that something special they have to contact you about?
No, it's if you go to the website at drfuhrman.com, they can click on the retreat tab and get information about the retreat.
Wonderful, wonderful. Well, that's so great. Everybody, I'm going to put the links to Dr. Fuhrman below, and I've done many other interviews with him. I'll put them below as well. I definitely recommend all his books, but definitely get his latest and greatest. And is there anything else you want to say to the audience today about this topic, Dr. Fuhrman?
No, just always the message is a message of hope and that it's worth it to take good care of your health because it gives you the ability to enjoy your life more and have more pleasure and fun in your life. And it's never more pleasure and fun to recreate with food and be sick, you know?
Yes. Well, everybody, I'm not one to telling people to just have free time and do anything, but if you get a chance to binge watch something, forget about Netflix, forget about YouTube, go binge watch Dr. Fuhrman's videos because they're so entertaining and informative. I know because I've been watched them. So thank you, Dr. Fuhrman, for being a guest, and look forward to speaking to you more in the future. Thank you for being here as a guest.
My pleasure. Good luck to all of you.
Nature's wealth, good for your health. This is the raw life.